The reason abdominal examination is very important is because exam makers love to ask about them because there's a lot of signs that you can see. And you will also use it a lot in the clinical practice and you will see it everywhere. You're going to start as always by introducing yourself, confirming the patient's name and date of birth, briefly explaining the examination process, gaining consent, and setting the bed at a 45-degree angle. You're going to start your inspection by looking at the patient's hands. Look for any signs of pallor, palmar erythema, Dupuytren's contractures, and then look at the patient's nails because there's a lot of changes that can occur and they refer to the patient's nails, like koilonychia, which is a spoon-shaped nails, and this can be a sign of iron deficiency anemia, and leukonychia, which is a sign of whitening of the nail bed. This can be due to hypoalbuminemia or some other liver disease. And of course, finger clubbing, which is a sign of cardiovascular or respiratory problems. And then you're going to move into the eyes. Look for signs of conjunctival pallor, which can be a sign of anemia, corneal arcus, which is a white circle around the cornea, and this can be normal in older patients. But if you see this sign in younger patients, say younger than the age of 50, this can be a sign of high cholesterol in the blood. And look for xanthelisma, which is a fat deposit around the eyes. And of course, the infamous Kayser-Fleischer ring, which is a golden circle around the iris. And this is due to copper deposition and is a sign of Wilson disease. In the mouth, look for signs of angular stomatitis, which can occur due to inflammatory conditions or some other malabsorptive disorders similar to iron deficiency anemia. Glossitis, which is a smooth redness of the tongue associated with enlargement of the tongue. This is also a sign of iron deficiency anemia, folate, or B12 deficiency. This sign can also be present in inflammatory bowel diseases. Oral candidiasis, aphthous ulcerations, which is round or oval ulcers that occur in the mucosa inside the mouth. These are typical in patients with iron, B12, or folate deficiency, and they are also typical of Crohn's disease. And you should also look for hyperpigmented macules on the patient's lips. And this can be a sign of colon polyposis. In the patient's abdomen, look for scars, abdominal distention, caput medusa, which is an engorgement of the paraumbilical veins associated with portal hypertension or liver cirrhosis. Look for strias or stretch marks, and this can be a sign of obesity, pregnancy, or Cushing syndrome. Of course, hernias, which should have a positive cough reflex, Cohen's sign, which is bruising of the tissues around the umbilicus, and this can be a sign of hemorrhagic pancreatitis, Gray-Turner's syndrome, which is a bruising of the flanks, and it's also a sign of hemorrhagic pancreatitis, and of course, stomas. In the palpation of the abdomen, you should ask the patient if they have any pain in the abdomen or tenderness, and you're going to start in the opposite side. Start superficial and then go deep. Look for any tenderness, with rebound tenderness especially, where you push with your hand and then suddenly relieve the pressure. And if the pain increases by this process, this is a positive rebound tenderness. And it's usually a sign of acute appendicitis. Look for voluntary guarding or involuntary guarding, which is also known as rigidity, Rovsig sign, where if you place your hand and push on the left iliac fossa, the patient would have pain on the right iliac fossa. This is again a sign of acute appendicitis. Look for any masses. You can also palpate the liver to see if it's enlarged. Murphy sign, where you ask the patient to inhale deeply and then palpate just in the right hypochondrial area. And if the pain increases with the patient's inhalation, this is a sign of acute cholecystitis. And you should also palpate the spleen on the left side to see if it's enlarged. Do the ballots of the kidneys by placing one hand in the patient's right flank or left flank, and then make a fist with your other hand, and then gently hit your hand on the patient. If this produces pain, this can be a sign of renal infection like pyelonephritis or renal stones. There are three main things that you should percuss in the abdomen: the shifting dullness. If you see any distension in the abdomen, percuss over the distension and then ask the patient to move to one side or the other while keeping your hand in the area that you just percussed, and then do percussion again. If the sound changes, this can be a sign of shifting dullness. And you should also percuss the spleen and the liver. Finally, we'll do the auscultation of the abdomen. Basically look for the bowel sound to see if they are increased or exaggerated, and this can be a sign of bowel obstruction. Look for the aortic bruit and the renal bruit, which is basically high thrills or high sounds that occur in the paraumbilical area, or just left or right to the umbilicus. Both of these indicates atherosclerosis of the aorta or the renal arteries. It can also be a sign of aortic aneurysm.